Person-centered care. As student nurses, there is so much for us to learn in order to become successful nurses in our future endeavours. Today, we will discuss and explore the key term person-centered care, focusing on direct patient care activities that assist in successfully delivering this. But first, what is person-centered care? We need to understand that patients are people and should be treated as such. According to the World Health Organization, person-centered care is defined as an approach that embraces the perspectives of individuals, families, and communities. They are seen as a participant and a beneficiary of the healthcare system, which humanely and holistically responds to their needs or preferences. Rather than focusing on the disease, the care provided centres on the requirements of the person. Therefore, the individual is at the heart of the decision-making process. Person-centered care focuses on respecting a patient's rights and treating them as an individual, building trust and understanding and developing therapeutic relationships. A therapeutic nurse-patient relationship is shaped by care and skill, resulting from a patient's trust in their nurse. This relationship allows the nurse to know the person within the patient and develop an authentic relationship. A person-centered approach improves patient outcomes by encouraging communication between the nurse and patient, as communication is integral to person-centered care. It builds on the care of a patient as a person and balances the moral interests of patient and nurse. Underpinned by values and respect for persons, person-centered nursing allows the development of mutual respect and understanding. The collaboration of a nurse's knowledge and past experiences with patients' needs, beliefs, experiences, and values allow for a positive relationship in which person-centered care can be delivered effectively. It also leads to better paired partnerships, collaborative decision-making, a decrease in mortality, improves a patient's satisfaction, reduces a patient's anxiety, and enhances their trust. In the person-centered framework created by McCormack and McCants, a range of factors that contribute to person-centered care processes includes working with the patient's beliefs and values, engaging authentically, being sympathetically present, sharing decision-making, and providing holistic care practice. The nurse must focus on the patient's values and beliefs, even if they are not in accordance. This is important as it reinforces person-centered nursing principles that allow patients to feel cared for and understood. Working effectively as a person-centered nurse and creating a person-centered environment will require integrating knowledge about people, what it means to be clinically effective, and knowledge about the care environment. There are many key factors that contribute to person-centered nursing, which further focuses on direct patient care activities. This can be seen in the person-centered nursing framework. Firstly, providing holistic care is a valuable process that contributes to person-centered nursing. Holistic care is a comprehensive practice that takes into consideration a patient's social, psychological, cultural, and spiritual implications. Cox and Tower have described building trust, negotiating knowledge, negotiating outcomes, and understanding the socio-historical aspects of health and nursing care as the framework to provide successful holistic nursing with a patient. Self-reflection is a crucial skill that develops a nurse's ability to provide holistic care. The Nursing Midwifery Board of Australia states in Standard 3.2 of the Code of Conduct for Nurses that having knowledge of how a nurse's own culture, values, attitudes, assumptions, and beliefs influence their interactions with people and families, the community, and colleagues is expected for all nurses in all practice settings in Australia. In addition, Cox and Tower recommend understanding power imbalances, strengthening communication skills and utilising the skills of interpreters to enhance the framework of holistic care. Reviewing and updating a nurse's attitude by increasing their knowledge allows them to empathise with the condition of their patient and improve professional behaviour. Providing holistic healthcare for patients and their families contributes to the practice of person-centered care by ensuring that they receive compassionate care and treatment applicable to their individual requirements. Alongside this, another process that helps nurses provide person-centered care is sympathetic presence, particularly focusing on consideration for the patient in relation to what they're experiencing at the time. It can be deemed that it is a nurse's duty to gauge a thorough understanding of the whole picture to further discern the best way that the patient can be supported. According to the fundamentals of nursing, ensuring that enough time is allocated to each patient is the largest contributing factor to result in a positive outlook and outcome for the patient. If the patient feels as though they have the time to express their concerns and feelings, often helping them process it themselves, it allows more information to be revealed about the patient, which can then result in more appropriate healthcare to be given. Another factor that plays a large role in person-centred care is engagement, mainly entailing active listening and encouragement to the patient as needed. Furthermore, active listening focuses on observational techniques to discern how the patient is feeling, often given away by body language and facial expressions. During patient interviews and health assessments, it is important that the patient has the opportunity to express their whole story and to therefore only interrupt them with questions if they are finished or the question is conducive to gaining information that is beneficial for further care. It is important to be mindful of any topics or questions that may be sensitive to the patient and to treat them with care and compassion during these stages. Being prepared to end the assessment early and continue it at a later time if the patient is distressed is also a useful tool. Shared decision-making between health professionals and patients is also considered an important key to person-centred care. When treatment options are being discussed with the patient, the nurse should make it a priority to ensure that the patient is aware of all of the possibilities and has the chance to consider the pros and cons of all of the options available. Nurses should be upfront and honest with patients and their families about outcomes, not giving false hope, but finding the best way to communicate to the patient and their family what is happening currently, and if necessarily, what may happen in the immediate future. Cultural and religious differences should also be taken into account when coming to a decision with the patient. Ensuring the patient is happy with the treatment plan that has been suggested and being willing to compromise together, if not, creates rapport with the patient. In terms of being culturally safe, nurses should further assess cooperative measures to ensure that the patient receives the help they need without overstepping their religious or cultural boundaries. Efforts that are made to ensure that person-centred care is always delivered, there are still some challenges that arrive in the real world of practice. McCants and McCormack 2016 expressed that leadership should be striving for relational connectedness. Leaders should be person-centred and should aim to enable associate self-actualization. It is essential for a leader's attributes to match the person-centred practice prerequisites, which include being authentically other person-centred, caring, intra- and interpersonal intelligence and reflexivity, working with the values and beliefs of the other, viewing the patient holistically, having an empathetic presence, shared decision-making, and moving through different levels of engagement. In direct patient care, the difficulty in maintaining a productive system of evaluation is a leadership challenge that nurses often experience. According to McCormack and McCants, leaders lead in relationship with others, and those being led are valued for who they are rather than as a means to an end. Nursing leaders have the critical role of guiding and educating due to the facilitated workplace learning environment incorporated by hospitals for student nurses to develop a professional model of care. In patient care activities, it is important for the nurse and student nurse to be sympathetically present in sharing and decision-making. By implementing a productive system of evaluation, a psychologically safe environment is infiltrated, and it allows the nurse and student nurse to be opinionated in relation to the patient's health requirements. Additionally, it also allows less areas for miscommunication and mistakes, as it creates an open environment for learning, relational connectedness, and authentic engagement. In 2018, Sebastian et al. Stated that a key leadership challenge involves sharing assumptions and priorities and examining how to bridge the differing worldviews to enact transformative change together. The nurse-to-patient ratio is another leadership challenge that nurses face in direct patient care. The Queensland Government states that there is clear evidence that the number of nurses on a shift plays an important role in patient safety and quality of care. In relation, nurses report to have less time to interact with patients due to the rush of having to attend patient after patient, and this disrupts the notion of authentic engagement and sympathetic presence. Nurses are then required to use a lot of emotional intelligence to work with the patient's beliefs and values, as opposed to connecting with the patient through conversation. The nurse-to-patient ratio is a difficult leadership challenge, as it is the nurse's responsibility to create a good care experience for the patient. There are many different views of models of health, and quite often the biomedical model of health is used to view patients or care recipients. This model means health professionals often only look at the physical and biological aspects of the person and their injury, illness, or disease. Illness is viewed as a malfunction of the body part or system only. This can be done intentionally or accidentally, but when using this model of health, it means that the person is not viewed holistically and their beliefs and culture are not taken into recognition. It can often be a person with a leadership role whom has these views and opinions, which causes great difficulty to provide person-centered care. The biopsychosocial model of health is a more appropriate model of health, which looks at the psychological, biological, and social aspects, providing a more holistic approach and improves the well-being of the person. Organisational culture can be a major leadership challenge, as it is acknowledged that unhealthy culture, poor leadership, and an acceptance of poor standards are too prevalent. This can cause power over associates instead of working with colleagues to provide the best person-centered care. If the organisational culture is not of the desired person-centered approach, then a nurse trying to change or demonstrate this approach will face multiple leadership challenges. When unable to understand another's worldview, this will cause an impact on leadership and ability to provide person-centered care. It is crucial for the nurse to understand their own worldview to be able to adequately care for others, especially when in role of leadership. If unable to do so, this can cause incapacity of cultural safety. Being unable to work with the patient's beliefs and values can leave the patient feeling powerless. All leaders should constantly reflect on themselves and if they meet the criteria of being a person-centered leader. Despite these challenges that arise in practice, there have been many innovations and initiatives designed to support person-centered care and direct patient care activities, often identified and led by nurses themselves. The Australian Nurse Family Partnership Program, also known as the ANFPP, was initiated in 2006 by the Australian Government in order to create an evidence-based program that would support mothers and babies in Aboriginal and Torres Strait Islander communities. Since its introduction, it has been running at healthcare services in the Alice Springs, Cairns, Wellington and Strathpine. In particular, this program aims to improve pregnancy outcomes, the child's health, the mother's parenting skills, and helps mothers to plan future pregnancies, continue their education, and find work, all for no cost to the parent. The program includes structured home visits, the use of guidelines and curriculum, monitoring and strong quality improvement focus, intensive staff training, and ongoing reflective practice and professional development. Additionally, the program comprises of nurse-led home visiting teams, consisting of nurse home visitors, nurse supervisors, family partnership workers or Aboriginal community workers, and administration staff. These members work collaboratively in order to result in the best possible patient outcome. The Federal Minister for Indigenous Health, Ken White, reflected on the successfulness of this program in March of 2017, noting that up until this point, 1,269 mothers had been enrolled in the program, with 18,579 visits taking place since the program's introduction. Nursing-led initiatives are also being seen within the hospital environment, which aim to improve person-centered care by increasing the healthcare staff understanding of patient needs. One example is the use of patient experience trackers, otherwise known as PETs. PETs are a survey tool originally trialled in New South Wales, which are placed throughout wards, and patients are encouraged to answer questions about their experience within the hospital. Questions are targeted around the patient's experience while interacting with healthcare staff. This data is then instantly recorded and accessible to be discussed upon next handover, further allowing nursing staff to collectively discuss what a patient appreciates and where improvements can be made. Another benefit of this initiative is that it utilises technology to communicate with nursing staff without the need for confrontation. This aims to allow patients to communicate openly and honestly. In turn, the initiative doesn't cost a lot of time for time-poor nurses, and yet still provides patients an outlet to communicate. Ultimately, enabling patients to communicate openly is critical in allowing nursing staff to understand patients. When nursing staff and patient have open communication, nurses can act to improve person-centered care. Lastly, it should be noted that this initiative doesn't work alone, and it is fundamentally important that nurses take time to directly engage with patients, and if they do decide to use this initiative, that feedback is taken on board and further followed up. Overall, it can be deemed that person-centered care is crucial in order to develop positive relationships with patients and their families to ensure that they receive the best possible care. Whilst initiatives have been introduced to push for person-centered care, there are still some gaps in the healthcare system that can be improved to take this step of improvement towards positive change. Thank you for listening.